Hello, everyone. Welcome to the December 2021 episode of Speaking of Wellness. My guest today is Rita Jablonski. She is a nurse by training and also a tenured professor and a business owner, which is how we met. She and I are both clients with Jeff Walker's product launch formula, and we were on this week's live coaching call, and she was called to be in the hot seat, and she shared what her business is all about. So I directly messaged her on Zoom and said, I am your avatar. Do you want to talk? Let's talk. So after the coaching call, we had our own Zoom call, and I fell in love with her. Got a girl crush, first admission. I'm going public with it, and she just really has a great way of communicating with people and understanding their pain, understanding what kind of assistance they need, and what kind of tools are really effective. I would say best practices. And so, without much more ado, I will turn it over to her and let her. I hope that piques your interest, and I will let her fill in the details. Take it away, Rita.
Well, thank you, Janelle. That was so awesome. I appreciate it. What Janelle was talking about is I'm an expert in dementia behaviors. And that was the conversation I was having with on the Jeff Walker call. I am a nurse practitioner and a nurse. I started out as a nursing assistant like a million years ago. And I was a nursing assistant in a nursing home. And back in the 80s, the training was, oh, you have a pulse and you're breathing and your background check shows you're not a serial murderer, you start work on Monday. And there was no real orientation. There was nothing about this is dementia, this is Alzheimer's. It was just and go. And I was working my way through nursing school. So I was struggling caring for people living with dementia who would hit me when I tried to do care, or who would ask me the same question over and over and over again. And I didn't understand why that was happening. In nursing school, we were told to present reality. Nope, that is the easiest way to piss off a person living with dementia. So I wound up going back to school and becoming a researcher, as well as having a clinical practice, because I wanted to figure out what is the best way to care for a person living with dementia that respects their personhood and dignity and doesn't have the family caregiver just go batshit crazy. Because I also was a family caregiver for a person with dementia. And even though I was well equipped, I was still the daughter-in-law. And it was hard for me to shift back and forth from daughter-in-law to dementia professional. And I struggled. And I remember going into the clinic the next day and telling my colleagues, wow, if I'm having all this difficulty, your generic family caregiver of someone living with dementia is basically screwed. And that triggered my desire to harness my years of research. Thank you for your tax dollars at work. I've been funded by NIH and Centers for Medicare and Medicaid and a bunch of other places. So again, thank you for your tax dollars, which funded my work.
Money well
But I
spent.
also
Money well spent for once.
I
Yeah.
appreciate that.
Yeah.
Thank you. But I also was in a clinical practice where every day I have family caregivers who walk in and say, what do I do? Because I was hired into this neurology practice that specializes in dementia care because of my area of interest and expertise, which is figuring out the behaviors, non-drug strategies to handle a lot of the dementia behaviors. And I think what's critical is that many of the behaviors that we encounter, like people with dementia saying, I don't need your help, or I can do that just fine, it's due to the brain shrinkage from the disease. Plus, sometimes we unwittingly trigger the behaviors. because Janelle and I had a great conversation. And in that conversation, we spoke in paragraphs back and forth, spoke rather abstractly at times. That's how we communicate. When we are working with someone who has some type of cognitive impairment, some type of brain disease where they don't have short-term memory, where their brain is literally shrinking, when we speak in ways we're accustomed to, the brain can't hold onto these big paragraphs. It likes things real small and little chunks, short, sweet, and concrete. So we frustrate the person and we trigger more behaviors. I don't know if that makes sense, Janelle, but that's how and so after working in research and in my clinical practice, I realized that I was limited by the research studies and the clinical practice to only see people either as research participants or as patients in my clinic. And I wasn't able to do the extensive caregiver support that I can do in my business. So my business has provided a platform where I can help family caregivers deal with the behaviors. And I do have a blog. The blog is where all my free stuff lives. And my blog is Make Dementia Your Bitch. And I have a podcast, Make Dementia Your Bitch, theme here. And I have a book coming out possibly mid-January. I'm still working with the editor, self-publishing. And the name of the book is Make Dementia Your Bitch, because why come up with a different title, right? My brand.
That's your branding, baby. And I'm sure New Yorkers will fall in love with that right away.
Well, I hope so. But it's funny because I do exercise at the university gym when I'm on campus. And I do give lectures to a lot of our neuroscience students and to different, types of students. And they see me in clinic. So sometimes I'm heading toward the treadmill, or God forbid, I'm in the locker room trying to get out of my bathing suit and put like real clothes on. And I'll hear, oh, it's Dr. Jablonski. She's the dementia bitch. And it's like, whoops.
That's not quite how the branding goes, but
yeah, that's not. And they meant nothing. They meant nothing insulting. It's just make dementia your bitch. And they kind of stuck it all together.
Yeah, that's funny.
Gotta love the undergrads. Gotta love them.
Well, they say bitch like it's a good thing. I'm sure.
Yeah.
Yeah.
Well, at least that's how I'm interpreting the compliment.
Yeah, that's funny.
This week.
Wow. So, and I know in my experience, a lot of times when you have dementia / Alzheimer's, it's often paired with hearing, a reduction in hearing ability. So,
yeah,
and concrete and loudly.
Well, you have to be careful with loud, because as we age, we lose our ability to hear higher frequency sounds. And I know that's a fact, because when my children were in middle school and high school, there was a thing going on in, I would say, 2007, 2010, where kids were downloading ringtones onto their cell phones that were allegedly unable to be heard by teachers, basically by anybody over the age of 30. That's how they were marketed.
Wow.
And my son, bless his heart, little smart ass, he put one of those ringtones on his phone. And so we're eating dinner, and I noticed the family dog every once in a while would respond. All of a sudden she's looking over here, and something's triggering her. And then I would look over, and there's my son trying to like do one of those side glances to his phone, and then, just keep eating like mom stupid. I let this go about for 2 or 3 minutes. And finally I said, Mark, turn your damn phone off. I'm tired of hearing it ring. He looked at, and he and his sister exchanged glances like, what? And I just said, yeah, I can hear that phone. What's your problem? But you're way over 30. Yeah, I was like 39 at the time. No, I was 45 at the time. Thanks, Mark. But I never and the dog got extra treats that night, since she was so cool.
Good girl.
But So what I tell family members to do is lower the pitch of their voice. If you're in music, it's your chest voice. By lowering the pitch of your voice and not shouting, you're in the frequency range that people could hear. Because a lot of times when people shout, their voice, especially women, their voice goes up in pitch.
Yeah.
And all the person living with dementia can see is you're highly animated and you're shouting, and they interpret that as you're angry. And I do want to say a quick thing about Alzheimer's versus dementia. Dementia is an umbrella term like car. And just like you have Fords and Hondas and Chevys, you have different types of dementia. So I can say, I drive a car. I can say, I drive a Ford F-150. Both are correct. So when someone says, my mom has dementia, it could mean any of several. You have Alzheimer's, vascular, Lewy body, Parkinson's disease, dementia, frontotemporal, and a couple of other ones that aren't so common. And as people age, oftentimes you have two or more pathologies going on at the same time, which makes diagnosis oh so much fun.
Yeah, because how do you rule out stuff if the symptoms don't fit one clear thing because it's fitting two diagnoses?
Right.
And
And,
I
and
didn't know that. That's interesting.
when I'm in a position where I'm trying to diagnose, I know that I think of the dementias as an upside down triangle with the base up here and the point down here. In the earlier uh, presentations of the different dementias, you may have very different symptoms and signs. So people with Lewy body, for example, not only do they have some of the cognitive issues, they also one of the main symptoms I look for is the report of acting out their dreams, which is a rapid eye movement or REM sleep disorder. If I hear that or I ask about that and I get a positive and I ask about some other things, that sends me to Lewy body land. On the other hand, and it also depends on age at onset, how long it's been going on. And so there's a lot of different factors to address in order to give the diagnosis. And when diagnoses are muddy, you can use MRI images to help, you know,
Clarify.
help you, yeah, to help to clarify which one is it. And if that's still unsure, you have additional imaging that you can order. And if you're taking your loved one to an academic medical center, to a teaching a medical center that has a university with it, and they do a lot of research, it is likely they have all the different types of imaging and the experts who can interpret the results. If you're going to, say, a small community hospital, you won't have access to a lot of those things because it's expensive to have certain types of machines and to calibrate them.
What
So
about
that's
like talking in their sleep? How does that
if
why does that
someone if
manifest?
someone always talked in their sleep, no. But if talking in their sleep suddenly happens along with Lewy body, you have what's called the fluctuating cognition. You have times of confusion with times of lucidity, like and it follows like a fluctuation over the course of a day or a couple of days. And the family member will say, you know, mom was really off on Monday, but Tuesday she was like normal. And that leads sometimes the family to think that the person just isn't trying hard enough, or maybe it's something else. And so you put together the fluctuating cognition. It's more like acting out their dreams, like to the point where they may sit on the side of the bed and you pretend to smoke a cigarette because they're dreaming about it. Or often the bed partner will say, I can't sleep with them anymore because she got up and slapped me one night. because in her dream, something was attacking her. So she was slapping it, unfortunately was slapping the bed partner.
Yeah, that I could see how that would be a problem.
Yeah, yeah, yeah.
Mhm.
But these are all things that you ask in order to figure it out. And it's also important for people to get a really good workup, because there's a lot of other medical problems that cause fuzzy thinking, like constant poor sleep. I know with me, and Janelle, you've been traveling, and I think you told me,
Uh,
like, with the time difference,
yeah.
you've been all like wackadoodles with your schedule, and one day you slept until 3 o'clock in the afternoon.
Yep. Plus, I wasn't, getting, yeah, just burning the candle at both ends for, at least a week prior to the trip, and then finally you get to where you're going and you're like, okay, my calendar is clear tomorrow, and your body just kind of shuts down for a while. It's,
So if people aren't getting good sleep, their thinking can be fuzzy.
yeah,
If my thyroid isn't working real well, my thinking can be slow and fuzzy. If I have depression, if I have uh, anxiety, all of that can interfere with the thinking processes.
yeah.
What
Can you,
what happens?
oh, go
Go
ahead.
ahead.
Oh, I was
I was
just,
going to say the MRI shows you if there's a problem with the hardware, but there's software issues that can make thinking glitchy. And it's just really important to get a great physical to make sure that your liver isn't acting up, your thyroid's okay, your kidneys are all okay. Because if a certain organ or set of organs aren't doing their job, it's a software issue. You get the fuzzy thinking.
it's amazing how everything is just so connected. And could you talk a little bit about, and you alluded to this a minute ago, the connection between dementia and depression?
Yes. So there's a couple different connections, and it's a chicken and an egg thing. In studies that have looked at correlations, which they're looking at two things happening together. Correlation does not equal causation, but it helps us look at clues. People who have had histories of depression, severe depression, seem to be more likely to develop dementia. That does not mean depression causes dementia. What it could indicate is the neurological changes that were occurring over a long period of time. You were losing neurons over time, and neurons make all the good neurochemicals. So if you have a billion neurons in your brain, you're making uh, a billion neurons worth of serotonin. If you're losing neurons and now you have a half a billion, your serotonin levels have dropped accordingly. So we don't know if the depression is due to brain changes that aren't being picked up, or if there is some type of link where people who are chronically depressed and there's insufficient brain chemicals, if that predisposes people to an Alzheimer's or some type of dementia. The jury's out. But what's really interesting is oftentimes I will get a call from a family caregiver, or I'll get a message in the portal, and they'll say, well, mom, she cries all the time. She's sad all the time. And in my practice, I always ask about depression and anxiety, because, again, dementia is a neurodegenerative disorder, which is a fancy word for the brain cells are dying. And as the brain cells die and you don't have enough acetylcholine, serotonin, dopamine, all the different brain chemicals, you see problems. And depression happens. Sometimes people have insight and they know they're losing their memory, and that makes them understandably depressed. But if that's not going on, we often use antidepressants to make up for the drop in brain chemicals.
This is so interesting. What was the other? There was another question I had.
Well, I wanted to go back to the hearing thing again, while you're talking. Sometimes, uh, depending on the type of dementia, different parts of the brain shrink faster than others. However, when I use the example of the upside down triangle, over time, all parts of the brain ultimately are affected. In, say, Alzheimer's, you may have more issues with a part of the brain called the hippocampus. You may see changes in there and some other changes earlier. Someone who has frontotemporal dementia, they tend to present with the front and the sides part of their brains shrinking earlier in the disease, and the hippocampus being damaged a little further down the road. So the presentation is different. But the temporal lobes, which live right here at the temples, they have your word dictionaries. When I learn the word tree, like that lovely Christmas tree in your background, I learn that the sound of a tr-e is that thing, that image. So I have a dictionary in my temporal lobes which match sound to words and ideas. I also have other parts of my brain that match what my eyeball sees with what an object is. Where I'm going with this is, a lot of times I'll have family members say, gee, I think, grandfather's losing his hearing because every time I say something, he says, what? I can't understand you. But he will be able to hear the dog bark, or he does hear other sounds. And what happens is, as the temporal lobes shrink, it's like pages being torn out of the dictionary.
Wow.
I'm hearing the sounds, but I can't connect them to the object.
It's like a foreign language. It's a word that's not in their vocabulary.
It
Interesting.
literally is a foreign language. It's like someone's talking Klingon to me, and I'm like,
What?
yeah.
Interesting. Interesting. So then I would imagine like the hippocampus versus frontal lobe would be like more emotional versus cognitive processing.
It can be, because everything's interrelated, and oftentimes when because you have the hippocampus, you have the amygdala, which is the smoke, I call it the smoke alarm. And that's what the amygdala does. Whenever the amygdala senses that something is a threat, it starts sending off signals. And it's the other parts of the brain that give context. So in my house, if the smoke detector goes off, it means one of two things: dinner is ready, or it means grab the dog and run because my couch is on fire.
Right.
The smoke detector going off, the smoke detector doesn't tell me boop, 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 dinner's ready. It just alarms. And then I act like the other parts of the brain, where I have to look around and look at the context of the situation and make a decision. And that is a lot of times why people living with dementia tend to refuse help, because or if you're trying to help them, they may say no, or they may push you away as the dementia gets worse, because they're perceiving a caregiving interaction as an assault. Like, why are you taking off my pants?
Right. Invasion of
You know?
privacy. I remember my
Yeah.
grandmother used to accuse, she had Alzheimer's, she was in a lockdown facility, and she would complain to my father that they would strip her naked and walk her down the hallway just to humiliate her. And so they would call him and say, okay, so your mother is accusing us of this. We just wanted to let you know, she kicked a nurse and missed and gashed her foot on the side of the bed, and she's bleeding. So when you come in, she's going to be bandaged. We just wanted to let you know how it happened. So they were very communicative in that way. She would get very violent, very combative at times.
And that was one of the earliest things I looked at in my research career. I remembered as a nursing assistant trying to provide intimate care and getting my hands slapped, or me getting slapped. And one of the triggers in long-term care is, or well, not just in long-term care, in any type of caregiving situation, mouth care. Trying to brush someone's teeth
Oh,
is a
wow.
double assault because you're literally getting in their face and then you're trying to stick something in their mouth and people don't understand it. When I was a nursing assistant, I was taught get the people up out of bed, walk them to the commode. While they're sitting on the commode and they're peeing and pooping, that's when you wash them and you do their mouth care and you do everything else. And I remembered, I recall every time I tried to do mouth care or different things while they were sitting on the commode, oh, all hell would break loose. I mean, I would get slapped. They would say no. They try to push me away, and I couldn't figure it out. And it wasn't until years later, when I was a nurse practitioner in a nursing home. At the time, I was working at Virginia Commonwealth University. I was an associate professor, and I had just completed my PhD, and I worked with two awesome people, Mary Jo Grapp and Cindy Monroe. And these two pioneer nurses, they're the ones who figured out that people on ventilators got ventilator associated pneumonia because nobody was doing mouth care, because there was a tube in people's mouths. And so the nurses said, we can't do mouth care. And they're the reason why there's all these protocols in place. So if someone's on a ventilator, you can do mouth care and there's a certain way you do it. Well, I would have lunch with these two awesome people. And I mentioned one day in my nursing home practice, hey, I have a core group of individuals who every time I turn around, they're presenting with pneumonia. And I treat them with antibiotics and we're good for about 12 to 16 weeks. And it starts again. And because they were treated with antibiotics, the next round of pneumonia is even more powerful and it's not responding to antibiotics. Could it be, do you think it might be the lack of mouth care? Because I also realized that segment of nursing home residents who kept developing pneumonia were the uncooperative ones. They were the difficult ones. And I started noticing when I was trying to listen to people's lungs or I was trying to look in people's mouths to do a good examination, I was triggering behaviors. So I went into the literature and I looked at, like there's a researcher, she's since passed away, Jane Chalmers. She did wonderful, she was a dentist and she was at the University of Iowa. She did groundbreaking work with how to provide dental care to people with dementia because that was her thing. So I found all of her research, all her strategies, and I'm like, oh, these are cool. So I put together my own little toolbox as a clinician. When I spoke with my research buddies and I said, hey, do you think this is something I should investigate? They were like, oh, yes. So next thing I know, we're sitting at the lunchroom writing, out my first grant. I had literally just graduated with my PhD and I thought I'm going to take off all summer and not do any work. Nope, I was right back writing grants because, strike while the iron is hot. Yep. So I took a lot of their work and adapted it. And that's when I realized something I published called the neurobiology of threat perception. I went into the brain because I kept saying, why are people living with dementia in a nursing home? Why are they fighting off necessary care? And when I went into, there's a guy by the name of Ledoux who's done a lot of work on the amygdala and how it rings alarms and how people perceive threat and all that cool stuff. I looked at his work. I looked at what Jane Chalmers did. And I kind of marinated it with my clinical observations. And I had this aha moment. And I published what's called the neurobiology of threat perception, that in people living with dementia, the amygdala remains fat and happy, and it's alarming all the time. But the other parts of the brain that say it's okay, they're offline. Or the connections have been interrupted.
There's no context.
Yeah. So one of the things, I think, Janelle, we were talking about this yesterday, facial expressions. And sometimes we were joking about something called resting bitch face.
Yes.
And
I was born with it.
okay, so should you become a caregiver, you're going to have to watch. And I learned early on to smile, even though some days I felt creepy, and to look positive, because if I'm being very neutral, someone may look at my face and think I'm angry with them and then resist care. So I came up with like all these strategies that I published. And actually, if anybody, if any of the listeners are interested, if they go to my website, makedementiayourbitch.com, I have a free summary, a free PDF of all the different care resistant behaviors. Not, excuse me, all the different care refusal strategies that they can look at and use if they're dealing with care refusals.
That is so generous of you. Thank you. That's a great bonus to this. And of course, it's making me wonder, how on earth do you work in this environment where everyone's wearing masks? You lose so much.
That is a yes. That is a real challenge, because with half my face covered up, there's no context.
Right.
So some of the things, first of all,
take the mask off and smile and say, "Hi, I'm here to blah blah blah, but I got to put my mask on." Like,
that's actually what I do, because I'm vaccinated, and for a while I was wearing like the clear face shields.
Right.
But what was happening is the light would hit a certain way and distort. So
Right.
it's like, oh, I can't catch a break. So what I do is I use a lot of gentle touch. I make sure I speak low and slow. And I will step back a good 6 feet and like, hi, gonna put it back on.
Yeah, like, hi,
And
it's me,
usually,
you know.
yeah, usually that works.
Yeah, I would
So
hope
far
so.
it has.
And it shows that it shows empathy, that you really want them to feel safe and you want to identify yourself before you approach to reduce, or try to prevent as much threat level as possible.
And
That's care.
other
That's
things I
lovely.
do in the clinic, that because I want to, there's something called elder speak, and I didn't come up with the term. I think it was I forget who came up with the term, but there's a nurse researcher by the name of Christine Williams who's done a boat ton of work on elder speak and how it triggers behaviors in people with dementia. Elder speak is baby talk. It's high pitched, sing song, and it's very demeaning. Like it's how I would talk to my dog. Like my dog is off camera, and if I wanted to interact with Amira, I'd be like, Amira, hey sweetheart, oh who's the puppy? Love the puppy. And right now her tail's wagging, and she's like, ah, well that's appropriate for it's appropriate for Amira and for my cats and maybe some of the grandkids, but it's not appropriate for an adult. And for some reason, when we're working with people with dementia, probably because sometimes the behaviors that we see are childlike, the person living with dementia may forget everything. They may even forget their name. They never forget that they are an adult. And that can also create problems for adult children when they're providing care and they're bossing mom and dad around. That's another topic. So I tell people to be real careful about elder speak, because you can slip into it. And I don't know if you've been the recipient, Janelle, but when I walk into an electronics store to get like some podcasting equipment, because like looking at 60 dead on, the younger people in these electronic stores make certain assumptions about me. As I'm making about them, I figured they're all living in their mom's basement, sorry. Kidding. But I mean, I'll go into one of my favorite stores is Best Buy. I love Best Buy.
Oh yeah.
I go into, yeah, I need to be banned because I spend too much money. But I'll go into Best Buy and I'll, some nice person will start to help me, and then they're sometimes they are shocked when I start to talk tech. But initially,
Good for you.
thank you. But initially, when they present me, they're elder speaking me.
Uh,
It's hi, how are you? And I was in a situation where I was talking with someone helping me, and somebody else came over. I guess they were bored. And we were talking about my podcast. And the person who came up, this young lady, looked at me and goes, "Oh, you have a podcast? Isn't that cute?" And I was like, you know,
Wow.
um, and I just looked at her and I said, "No, it's not cute. It's freaking amazing, and it's about dementia and da 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 da. And it's called Make Dementia Your Bitch." I mean, my filly came out, which isn't cool in Alabama, but I know I viscerally reacted when someone was elder speaking to me and it felt patronizing and demeaning.
It's so
So I am,
it's so funny that I'm sorry to interrupt. I just want to insert that it's like how old were you and I when, Apple computer was born? Like I remember laying eyes on the first Mac SE, the Yay Cube,
yeah, I
back
had a Commodore.
back in the 80s. And they
Mhm.
just don't understand that our generation, was in college when microcomputers were born.
Yeah, and we are digital immigrants where they are digital natives.
Right.
And that brings up another interesting thing about abilities. Most people think of dementia as, oh, I just lose my memory. No, you also lose your ability to do things. And we call it praxis. And praxis is my ability to, I'm going to take a glass of water and sip it, or I'm going to play around with my camera. We lose things in the reverse order that we learn them. So my generation and the generation, the baby, because I'm Gen X, so the baby boomers, some people never figured out how to use a smartphone. But for people who learned later in life to use a computer and to use an iPhone, that's the first activity that they lose.
Hmm.
So oftentimes I'll hear, "Mom can't figure out the TV remote. Dad he doesn't use his iPhone the way he can answer it, but he doesn't use any of the apps. Um, my spouse foobarred the online banking." What's interesting is the generation, the later Gen Xers and the millennials, when they are in a position, when they're old enough and they start having cognitive issues, their ability to use electronics will likely persist longer because they were exposed to using electronics much earlier in their life.
In the strollers.
Yeah, in utero. But right. Because it's
That's
even funny, like with my kids, my eldest didn't get a cell phone till she was, I think, a freshman in high school. My middle daughter got a cell phone when she was in middle school. My son Mark, I think he had a cell phone in elementary because it became the norm
yeah.
to have for children to have cell phones younger and younger.
Yeah, I'd love to discuss that whole issue. I forget the author's name, but he wrote a book. He was a pediatrician, wrote a book called Glow Kids, and
Mm.
on the subject of how it's actually an addiction, like crack, like the
Oh
digital
wow.
digital addictions with children. It triggers the same areas of the brain as, as crack. So it's yeah,
Wow.
but that's another, I digress.
Yeah. That's
My
next week's topic.
Yeah, let's do this again. Let's pivot onto that one because I'm sure you could speak a lot about that. Um,
Not really. I'm not big. I'm not knowledgeable about addiction. I live in dementia world, and
yeah.
that's where I'm happiest because I love. It's funny, but I'm the expert the experts go to. In my clinical practice, I work with some amazing neurologists over in Parkinson's or in other areas.
Uh-huh.
And whenever one of their patients presents with dementia and then the family is seeking help for behaviors, I get the referral. And I've even been asked, to
like niche
uh,
down to this very, very narrow, specialized needs population. And that's one reason I wanted to do this interviews because, as baby boomers age every day, my generation, our generation is this issue is absolutely trending. And I'd be curious and see what data you have in terms of demographics and projections on the demand for the service that you offer. That would be one question I could throw out. And the other question that I always ask in these types of conversations is, my listeners know one of the mottos I say the most is to prevent the preventable. And
yeah.
so if you want to comment on any of that at this time,
Oh, I would love you're yes.
especially in
Thank you.
nutrition, what
Well,
can I do for myself, but also what can I do for folks who are either early onset or well into it? What how can I help them?
okay, well, first, early onset is a different type of dementia. Early onset is defined as dementia before the age of 60. And it's highly genetic. And then, but a lot of clinicians mix up early stage dementia, which is the same as mild, and that's where people are having problems with things like banking, and they're starting to show memory problems, versus the moderate stage where they need a lot more help, and then the severe stage where they are dependent on someone for 24/7 care. And I just throw that out there because there is something called early onset Alzheimer's, which is different from uh, regular or later onset Alzheimer's.
But mild.
And
But I understand.
yeah,
Okay.
but I also hate that term mild, because to me, a cold is mild. Dementia, there's nothing mild about it. It's just earlier in the disease stage, it's affecting fewer things. But I just toss that out there because sometimes people, I mean, there's so much jargon.
Yeah, I didn't know the difference. I was thinking, yeah, early onset meaning it's come
It
upon us
just
at its
started.
early stage. I really thought the phrases were equivalent, so that's good. That's interesting to know.
Yeah. And so talking about prevention, all of the stuff your mom told you to do, or your father, get enough sleep, good quality sleep. Keep your body weight at ideal body weight. Exercise, I mean, daily. I think the uh, US public health recommendations are 30 minutes, 3 times a week. That's not enough. Really, ex- I exercise all but 1 day a week, and I do different things. But if you have high blood pressure, aggressively control it. If you, first of all, try not to develop diabetes. I know that sounds tacky, but for people with type 1,
Yeah.
you keep very tight control of it. And now with insulin pumps, you can do that. But for those with type 2, that diabetes is linked to obesity and a crappy lifestyle. Lose the weight, eat healthy, follow the Mediterranean diet. The Mediterranean diet has been shown to be the most brain friendly one out there. I know a lot of people are into keto. Keto doesn't have the track record and the studies that Mediterranean does. So I think the jury's out with keto, but Mediterranean is where it's at. Lots of fruits and vegetables, fresh fruits and vegetables,
Yes.
lean proteins, get your fat from plants. I love the cooking with avocado oil because I can turn it up real high and it doesn't smoke like olive does.
Right.
And the big thing really is the cardiovascular risk factors, because if you have high blood pressure, your blood vessels are breaking down and you are depriving blood to the brain. And so chunks of cells die, which is what gives you vascular dementia. And there's also some thinking that if you have higher risk for Alzheimer's and you have vascular problems and you are losing neurons because of vascular disease, strokes, TIAs, it will unmask your existing Alzheimer's. So let's say I have Alzheimer's pathology starting in my brain, but I won't see it until I'm 85 because it has to build up to a certain point, and I lose a critical mass of neurons, and then you start to see the repetitive speech, asking the same question over and over. All right, cool. That's where I'm headed. Well, let's say I have high blood pressure or high cholesterol, and I decide who cares, or I'm working with a clinician who isn't on top of it, who isn't helping me tightly control these risk factors. I'm going to start to have strokes that I may not be aware of. And I am going to be losing chunks of my brain, little Swiss cheese holes. So I'm now losing neurons from a cardiovascular problem, while I also have the Alzheimer's going down. So if you add the cardiovascular risk to it, I now am showing symptoms at 72, not at 85. And these numbers, I'm just throwing them out there. I don't have some type of algorithm, but I just want to make the point that by protecting your cardiovascular health, you may, and if you were dealt genetic cards for Alzheimer's, you may have a longer life without the signs of it
Higher quality,
until much later on.
higher quality of life.
Yeah, higher quality of life. And that brings us to the demographics. The demographic right now that's really, unfortunately, having higher cases are African Americans, who are also disproportionately affected with diabetes, obesity, and high blood pressure.
Yes, yes. I have some friends who are starting to really reach out into the Black community in Westchester County. Damon K. Jones is coming out with books. He just came out with a book on clean eating,
Mm-hmm.
and he's very, very active on social media. And he's been a guest on my show more than once, and really a great advocate in helping the Black community understand that, you know, these foods that are part of the culture can be tweaked. You can still enjoy them, but, you know, let's talk about more exercise and quit smoking and, you know, balance things out. Um, yeah. Again, preventing the preventable. My understanding, I've been told by uh, someone I know who's researching on Alzheimer's. He mentioned to me something about like highly processed deli meats, um, and what else? Especially aspartame that turns into formaldehyde on the brain. Can you talk a little bit about that, the artificial sweeteners?
I do know that there are people in the population who are very sensitive to artificial sweeteners. And in fact, I see it in my own family, where I have family members, if they ingest artificial sweeteners, they present with acute memory loss, like they're having a stroke.
Like right away, like
Yeah,
within.
within a few minutes of ingesting it. So I have that lived experience, and I will not go near artificial sweeteners. I don't care. I just won't. And there are some too much sugar can be a neurotoxin, because too much sugar you get inflammation. And there's some theories that the beta amyloid plaque that you see in Alzheimer's is the brain trying to heal itself from like a swelling or an inflammatory process. And tau is a protein in the brain that when cells are damaged, they make tau to fix the neurons. So there's some experts wondering if you get too much tau, or you get weird versions of the tau protein, because the brain is injured from chemicals, from processed meats, from artificial sweeteners, from too much sugar, from various assaults on the brain or combinations of these assaults. And as the brain's trying to repair the neurons, it's producing too much tau, which is then triggering all these other processes that result in neurodegeneration down the road.
Wow. So it's
So,
almost like I've done a little study of CTE, you know, chronic
Mhm.
traumatic
Yes,
encephalopathy.
the
But
encephalopathy,
that has
yes.
more to do with inflammation due to physical injury. But what you're talking
Yeah.
about is chemical, almost, is it like burning the chemical burns in the brain?
It No, it just has to do with the
Inflammation.
chemicals just triggering an inflammatory response.
Okay.
And I don't think we know everything yet. And there is a temptation to say, oh, there's just one thing. If I do this one thing, I will reduce my risks. And because we all have different genetic makeups, I mean, look at George Burns. What was he, like 95 or 100 when he died?
And
And
smoking
that was a
a
guy,
cigar.
yeah, he always had a drink in one hand, a cigar in the other. Somehow he made it through, and it could be that his genetics were such that alcohol and cigars, meh, his body just accommodated it. Whereas somebody else picks up, one cigar a couple times a week, and they put together this whole cascade of negative stuff. That's why it's so hard just to say, oh, it's this or it's that, because then you have protective factors. So I may have a crappy diet where I'm eating nothing but processed meats all day long, but I'm physically active. So I may be so physically active and get plenty of sleep that my body can adapt to and undo the harm I'm exerting on my body from poor food choices.
Yes, like when I was in my master's program in public health, there was kind of a uh, there was a conversation about if someone smokes, I think it was like 2 cigarettes a day, but they're doing 45 minutes a day, or at least 3 4 times a week of like hard cardiovascular workout, it
Mm-hmm.
cancels out the 2 cigarettes a day. But we're not going to ever tell anybody that because of the addictive nature of cigarettes, and it's hard for people to stay at two a day. So we just say zero and just like not even have that conversation of mitigating
Well,
factors.
and that's where the whole red wine is great for the brain came out of, because there were studies done in populations where there was a great deal of alcohol consumption, but these populations were also not sedentary. I'm thinking of certain studies that happened in Europe
Mhm.
and specifically in France, where yes, these people might be drinking a couple glasses of wine a day, but they're walking everywhere.
That's
They're
right.
biking everywhere. They're not driving in their cars.
Yep.
And so just because things happen, I mean, if you want to be ridiculous about it, I could say breathing is a risk factor for dementia, because if I have 100 people with dementia, what do they all have in common? They all breathe.
Oh, that's a
I
good
mean,
one.
that's being silly,
That's a good one. That's a good
but
one.
that's how a lot of research works. You get a bunch of variables and you do magical statistics, and certain things pop up in the data as, oh wow, 60% of the people with this problem also had something else. I had a stats professor that used to have, he had this really cool diagram, and he would talk about how in certain times well, if you look at a year's worth of data, ice cream consumption and drownings always seem to follow the same pattern.
Hmm.
So does that mean that people eat ice cream are more prone to drown? No. In the warmer months, people are going to flock to oceans, lakes, and swimming pools where a drowning can occur. In the warmer times of the month, people are going to eat ice cream. I mean, right now
Good
it's
one too.
40 degrees. I have ice cream in my fridge. It's like 40 degrees, and I'm like, I'm not eating ice cream. It's too cold.
Yeah. Yeah.
But
I
that's
think
an
the one I
example of correlation, like things that happen just because things happen together doesn't mean one's causing the other.
That's right.
But too often times people look at those types of data and go, aha, there's a relationship. Nope.
Yeah. And there are other variables. I think the one that I remember from class was you know, like activists in a community were fighting um, against building more churches because the more churches an area has, the more bars they have, and they wanted to prevent more bars opening up. No, never mind that the bigger a city is, the more of both they have. So that's another. That was my first example on that. Really interesting stuff. Um, yeah, this is just a whole new world that I believe is going to be becoming much more and more a part of people's experience worldwide, but especially in the United States, where we've got, I mean, our longevity is declining a little bit. I understand that there's a downward trend for the first time in many years, that life expectancy is dropping. What do you see as the future? What is
Well,
your vision of the future? What do you see happening in terms of demographics, and what is your
well, right
vision?
now there's 6 million people with a diagnosis of some type of dementia. And when you look at World Health Organization predictions, I think by 2050, the number of people living with dementia is going to double, and in some cases triple, depending on what area of the world you are examining. And right now, there's 15 million family caregivers in the United States. And being a family caregiver takes a toll on the caregiver. It takes a toll on their finances, because I may have to leave the workforce early to care for an aging parent or a spouse. It takes a toll on people, their health, because often we see family caregivers who may die before the care recipient, because the caregiver is not taking care of their own health. They're overwhelmed. They're
Mhm.
busy caring 24/7 for this person. How can I possibly go go to the dentist, or get a pap smear, or get a colonoscopy, get a mammogram? It's not unusual for the family caregiver to die before the care recipient, because the caregiver of the person living with dementia is skipping mammograms, pap smears, colonoscopies, all the good preventive stuff, because they feel like they don't have time to go and take care of themselves because they're busy being a caregiver. And then what happens is one day the caregiver wakes up and the disease, whatever it is so far advanced, it may not be fully treatable at that point. So, for those of you who are listening, if you have someone in your life who is a family caregiver, here's something you can do that will make a difference. Call them up and say, "Hey, I am willing to relieve you of your care every Tuesday afternoon, once a month for the next several months." Or say, give them something concrete, because oftentimes as a family caregivers will say things like, "Well, I don't want to bother people," or I feel bad. And you are sitting on the sidelines saying, "I want to help, but I don't know how, and I don't want to overstep." So you may, as the outsider, need to pick up the phone and say, "I'll sit with your dad every other Thursday, or one Thursday a month. I can do that." Or better yet, "Can I take your dad somewhere?" Because the person living with dementia needs respite, and so does the caregiver. I've worked with this phenomenal person, Daphne Johnston. She started respite cares in I want to say, Dothan, Montgomery area. I think it might have been Montgomery. Anyway, she started with a faith-based community, something called Respite, where it's a volunteer model. And this way, the person living with dementia shows up and they get the same sticker that says volunteer and their name. But there's also regular volunteers. So every care recipient who shows up is assigned a buddy, is assigned a volunteer. And for 4 hours, the person living with dementia gets to be treated normal. And maybe the church is putting together baskets to send to the armed forces, or
Oh,
maybe they're
that's
doing
nice.
something with the daycare that's on site. They
That's
have activities, they have sing alongs. And I have heard some of the people I see tell me about oh, I go and volunteer, is what I'm told. And I go, that's awesome. I think that's a beautiful idea. And I've actually shown up at some of these respites. And honestly, unless I really sat back and had to watch for a while, I couldn't tell who was the volunteer receiving the services and who was the volunteer providing the services.
that
So
is
Daphne's she's written a book on how to put these respites together. And I actually want to interview her for one of my podcasts, but I can always put you in touch with her because
I would love
Daphne
that.
is,
Yeah.
yeah, she's a force to be reckoned with. So she's been traveling all over the country, helping faith-based communities with this respite model. And what's nice is it's 4 hours a day, lunch is included, and
Mhm.
it gives the caregiver a 4 hour chunk to maybe go to the dentist, or at least just have 4 hours where they're not being asked the same question over and over again. And what I've noticed is interesting is just like the caregiver needs a break, the care recipient needs a break. Because if I have someone who's caring for me all the time, we're going to get on each other's nerves. Because when you think about it, if I have dementia and you're my caregiver, the interaction I have with you is probably constantly going to be, Rita, don't do this. No, Rita, come over here. No, Rita, you're putting your shirt on upside down. I mean, you don't mean to be mean, you're providing guidance. But as a care recipient, all I'm ever hearing is what a screw up I am. And
Yeah.
the thing is, the memory may fade away, but the emotions stay.
Huh.
Um, I don't know, Janelle, have you ever gotten into an argument with somebody and it lasted all of 30 seconds, but you felt like crap the whole rest of the day?
Oh yeah. I've had to learn to really learn how to shed that. Who was that who gave that saying? People don't remember. They don't
What
remember.
you say, they remember how you made them feel. Is that?
Yes, I forget who's attributed who that quote is attributed to, but
But that's even more true for people living with dementia, where I may argue with my mom, and now she's sitting there upset, and then 30 seconds later she forgot exactly why she's upset, but she just knows she's upset. And see, emotions are linked to specific memories. Every memory has some type of emotional charge. The charge may be neutral, the charge may be strongly positive, the charge may be strongly negative. So if my mom is sitting there and she's stewing, she's that emotional, that emotion is going to start pulling in whatever memories are tethered to that emotion. So all of a sudden, she's going to start thinking about the fact that her mom died, or she's going to think of something bad that happened. And she may start to ruminate on something negative. And that's where caregivers will say these memories or questions come like out of the blue. Like my mom's just sitting there, and next thing she's talking about her dead uncle or a child that died. And you're sitting there going, how did that happen? It's because of the emotion that is staying there. So that's why I tell or I help family caregivers modify how they communicate so that they're keeping the communication, the emotional voltage as positive as possible. And some of the strategies I suggest is if your loved one is telling you they don't need help, or they're telling you they don't need to get a bath, and you know they do. They're not in denial. Part of what's going on is something called anosognosia, which is a Greek word, and it's fancy medical jargon for I forgot that I forgot. Because I have short-term memory loss, I am not aware of my deficits. I'm not aware that I can't do something. I have a memory of getting a shower. Even though right now, if you tell me to get a shower, I'll walk into the bathroom and I'll forget why I'm there. Or I'll get the steps mixed up. I may walk into the shower fully clothed and then go, wait, what's next? And then at that point, something distracts me and I leave. So when you are being told, no, I don't need help, or you're being told, no, I already had a bath, and you know that's not true. Some of the techniques I suggest, one that works really well if you are an adult child, is to ask for help. Because as a parent, I am wired that when my kids need help, I'm going to help them. So you could say, Mom, could you help me? And go over there and point to the bathroom. Because that's another thing I help family caregivers with. I help them shorten up their communication, short, sweet, concrete. Don't say, go into the bathroom and take a shower. You have to unpack it. And that's when I hear family members saying, well, I told him to go take a shower, but he just walks in there and walks out, and the floor's dry. There's no evidence he took a shower, but he told me he did, because he walked into the bathroom, looked around and said, well, I'm not wet. I must have taken a shower. Cool. And out he goes. So there's all different ways to break the activity into steps and to guide your loved one in a gentle and respectful way that you're not nagging.
I love that. I love that. And the word respect is really key here, and you've alluded to it before. I I talk a bit about Marshall Rosenberg's nonviolent communication, and the
Mm-hmm.
framework is based on, you know, all violence begins with disrespect, and
Ah.
so it helps kind of shift the framework of always being mindful of being respectful, because it can feel like a, beyond a violation. It can feel like it. He actually calls it violent communication when there's
Mm.
disrespect running through that. Now I have another question for you, and you can get to it now or next time if we do this again. The delicate question of, like, I'll use myself as an example. I'm divorced. I've been divorced for over 20 years. I don't have any children. And my brother's married with 2 kids, full-time work. He's very busy. His wife works as well. He lives 100 miles away from my parents. I live in New York. I'm visiting
Mm.
here for a few weeks just to kind of get the lay of the land. And I'm looking at it through more of a healthcare lens, because that's my background. Um, just to check in on my parents and just see what's going on. What do you say to families where there could be 5 or 6 kids, but there always seems to be that one child that everything lands on? Um, that's been in my experience. I have, not always, I have seen families where they take turns, spending weekends with mom, or grandma rotates 3 months living here, 3 months living here, etc. Um, can you talk a little bit about that family dynamic, and what is
Oh
the
yeah.
way for
Um,
the
when
loved
I
ones to be a team?
it's really it's in some families it's a bigger challenge than others, because you have all of that emotional baggage and all of that stuff that's been going on for a long time. The first pattern I see is, like you said, the sometimes a family member is selected as the default caregiver because of their life circumstances. So if there's 3 siblings and one sibling is unemployed, The assumption is unemployed sibling doesn't have a job. He or she can go live with mom and take on the role of caregiver. But what happens is it becomes very unfair. I've seen situations where you have, again, 3 adult children. One of the adult children just got divorced, doesn't have a job, has a couple kids. And so the family thinks, hey, let's send Jane into mom's house because Jane doesn't have a source of income. She needs a place to stay. She has the kids. Mom will love the grandkids. It solves 2 family problems at once. But does it? Is Jane suited to be a caregiver? Just because I'm a female and I have a uterus doesn't mean I should be a mom. Merely giving birth does not magically make me a mom. And unfortunately, in most families, if you are a female, the assumption is you're a perfect caregiver. That's a problem. And then Jane is now living in mom's house, taking care of mom, but Jane has no resources. So if mom doesn't have internet, Jane's kids need internet to do their homework. I mean, anymore, internet is a utility, just like water, sewer, electricity. So Jane purchases an internet subscription using mom's money. Next thing you know, the other 2 siblings are upset because she's using mom's money. Really, I've actually sat siblings down and said, okay, the cost of a live-in caregiver, depending on where you are geographically, in my neck of the woods, the cost of a live-in caregiver is 12 grand a month, about. So I look at the 2 siblings. Yeah, 12 grand. I mean, yes. If you have if you are dealing with an agency and they are sending in people 24/7,
I had no idea.
you run about 12 grand is probably on the low spectrum. It's probably more like 15. So I said to the family, Jane is saving you all 15K a year or 15K a month. So you both going to pay her 7,500?
Yeah, that's like
And
at least 3,000 a week. I mean, who's going to shell that kind of money out for unemployed?
And when I frame it like that, all of a sudden the other 2 sibs are like, yes, Jane needs to have internet and she needs to have a subsidy. Now, there are certain programs with the VA and in some states, not a whole lot, where if I'm a family caregiver and I'm taking care of my mom, who is the widow of a veteran, or I'm taking care of my mom who was a veteran, I can apply for a family caregiver stipend, and I don't recall the amount. It's a boat ton of paperwork, and I applied for it to tell you how great, the VA, how quick the VA is. I applied for it, and 9 months later, my mother-in-law died, and the paperwork was still somewhere in the system. Maybe I should have gotten an attorney, I don't know. But there are mechanisms to reimburse family caregivers. I think there needs to be more. Some states have what's called a Medicaid waiver. So if you are a family caregiver taking care of your family member and they meet the criteria for nursing home placement, Medicaid will pay for services to come in to keep your mom at home. So you're not doing 24/7 hands-on care. I think in New York, I know of people I've worked with who had, thanks to this community or this waiver program, had a caregiver 5 days a week for 12 hours. I was like,
that's so important because then they can work outside of the home and
exactly and take care of the family member. So that's a tricky conversation. Sometimes if you are the healthcare person in the family, the assumption is, oh, you're a paramedic, you'll make a great caregiver. No, you won't. Just because I'm a nurse, and I'm not picking on paramedics, so sorry guys and gals if you're listening in. What I'm saying is the skill set of a paramedic is arterial bleed, do something.
Yeah.
Emergency.
Yeah.
Right. It doesn't mean you know how to care for somebody with a chronic disease like dementia.
Yeah.
In fact, I work with the Mid-Alabama Area Agency on Aging. They've had a big grant, and I'm one of the people they employ. And I have a whole training program for police and fire and paramedics to help them work with people living with dementia. So that's another thing that I see happen. So it comes down to literally a family meeting and coming up with some type of plan, because it's not fair that one person becomes the 24/7 caregiver and then the other. I mean, I've already decided if I'm in a situation where I need to participate in my mom's care, and my siblings may decide I'm the one closest to retirement. I have a business that I'm building that I can do from anywhere. My siblings may decide, Rita would make the perfect caregiver.
Right.
Okay. But we're going to set down some ground rules. And that is, I get every weekend off. So if I'm with mom Monday through Friday, that means out of my 4 siblings, the rest of you rotate and take a weekend. And you also follow my rules, because here's the other thing that happens. I'm taking care of mom. I have her medicines on a schedule.
Yes.
I have her activities on a schedule. When we use schedules for little kids, we are creating memories and patterns. We are laying down neural networks so that they can function. In people living with dementia, we use schedules to maintain those neural networks, to keep the person functioning as long and to do as much as they can for as long as they can. Because if I start doing for a person with dementia and they're capable of doing it, they may forget how to do an activity. They're not going to be able to relearn it. So that's why promoting independence is so important. So I have this awesome schedule, and it's Friday afternoon, and it's my weekend off. And here comes my brother, and he looks at my schedule and says, "This is stupid." And he decides, well, mom doesn't need these medicines at 8 and at 4. I can just give them all at noon. That's not how those medicines work. There's bioavailability and there's other stuff. So he screws up the meds. He decides she doesn't need to take a shower. She can wait till Monday because she's being a little difficult. So then when I come back Sunday afternoon to take over, it's going to take me until Thursday to get everything according to plan. And meanwhile, I'm going to be dealing with a lot of care refusals, agitation. People talk about sundowning. Sundowning is a constellation of behaviors that are triggered by a lot of things, including fatigue and too many changes. Because when I have everything according to plan, I don't have to use a whole lot of brain juice to navigate my environment. If my environment is now topsy-turvy, I'm having to use a lot of brain juice and brain energy just to function. And instead of having this much, I only have this much brain energy, then what's going to happen is I'm going to use it up and I'm going to be exhausted and frustrated. And then you get a lot of the sundowning type behaviors from fatigue, frustration. So that's something else to consider. If I'm going to be the primary caregiver, I'm going to have built-in respite and we're all going to play by the rules. If that's not going to happen, we are going to have to come up with some type of alternative.
And
I also,
sorry.
go.
Oh, I was just
Well, the other,
one of the radio show hosts here at WVOX is an expert. He's on, I think, every other week to talk about Medicare issues. And I had a conversation with him on the phone a few weeks ago. We were talking about this very issue where he tries to work with the family members on how to get on the same page to make sure that there's, optimal care for the parent or parents. And
Mhm.
I just see a huge gap in there because, well, I'm new to this. I mean, I'm just learning about this, but it seems to me that you're really touching on a very, like I said in the beginning, a very important pain point for people that is only going to get more prevalent, and how our siblings and cousins, because the cousins all have the grandparent in common, so that kind
Yes.
of helps expand a base if there's more kids in the family of that generation who can take care of the grandparent. But how to bring everybody on board and make sure that the drugs are not given double at noon, but they have to be done at 8 and 4, and that mom can't eat these certain foods,
Right.
or she can't have a lot of water to drink after 4 p.m. because she goes to bed at 7 and she'll wet the bed, or
Or
you
she'll
know
get up to pee and then be peeing in the laundry room.
yeah, yeah, and like stuff
Yep.
that you would never imagine because you're not familiar with dementia. Like I didn't know she'd go sit in the car and try to drive it, you
Oh
know
yeah.
it's
Oh yeah.
crazy.
I have for my podcast and my blogs, I have a whole series on how do I know when it's time for my loved one to stop driving, and how do I take away the keys? Because that's a difficult conversation. And the other thing that I do with my coaching is when I work with families and people purchase a package of coaching sessions, I encourage up to 3 family members to be on the same call, because it's not usually one person doing, I mean, it can be one person doing everything, but usually there's the primary person
Yeah,
and there's other sibs. And this helps me. I'm the bad guy, not the bad guy, but I'm the voice of authority who can support the primary caregiver and say, okay, gang, John's here Monday through Friday. So Mary and Fred, you two have to pick up the weekends, and you have to keep her on schedule. And then I can talk about the importance of schedule using neurobiology and all the skill set I bring to the table. So it's the expert telling the family, this is what you do.
right.
It's not John having to tell both his sibs, because then you get into
John is,
family dynamics.
yeah,
Yeah.
and
What
John
if, what
is
if
like,
John's
listen,
the youngest and they've never listened to him before?
oh,
They're going to
there's
blow him
another
off.
layer. So John is just doing what you're recommending because he trusts you as the expert, but he
Right.
can't do it all by himself, which is what you're telling him in the first place anyway. So
Right.
John needs support, but John can't do it by himself. But this is, if we're going to be a team, this, what Rita's saying is what we're going to do. Do we all agree on that?
And then from a cost perspective, you can split the cost of the training 3 ways. Each sibling can pay a third instead of, so it actually becomes cheaper when you have 3 family members on the same Zoom call.
Mm-hmm.
And
Mm-hmm.
then everyone's hearing me say it. It's not, I'm talking with John, who then meets with Mary and Fred and has to, then it's whispered down the lane because
Right.
then Fred's arguing with John. I even do that in the clinic. Family members will say to me, especially now with COVID, you can only let one person in. Well, if people are in the waiting room, I'm like, bring them all in. I mean, you all traveled together. I don't care.
Right.
And I will plop everybody in the examination room. Or the other thing I do is I have one of the caregivers put like patch in the others through a conference call, and I set the phone where they can hear me and they can hear. We've tried FaceTiming. Sometimes that works, sometimes that doesn't because of the Wi-Fi in the exam rooms.
Yeah.
But I've done conference calls where everybody's hearing what I'm saying and everybody can ask questions.
That is so, I can't imagine. a component that would be more important than that, because everyone needs to get it directly from you, the expert. You've got
Right.
established authority, and especially like what you're saying, if the primary is the youngest of, a brood of 10, yeah, it just means they're on Team Rita, not Team John.
Unfortunately, that's what it is. I mean,
Coach.
I do a presentation with different healthcare providers, and I call it, I'm not a family therapist, but I play one in the clinic because I am not a family therapist, but there are times I'm helping people with complicated family dynamics.
Yeah. Yeah.
Because there's always one sibling who's the expert on everything. It doesn't matter what you're talking about. That person knows everything. And sometimes it's my job to kind of like shut them down a little bit and then bring them back so that they're not busy telling everybody else what to do. So, oh yeah, I kind of enjoy doing it because I like the end result, which the end result is I save families years of trial and error.
Yeah.
I actually had someone
I can see that.
discover, yeah, she just discovered my blog. And okay, so I signed up for a podcasting class through WordPress because I have my blog on WordPress. I've been blogging since 2017. And I kind of wanted to, like, move into the 21st century because I think fewer people read blogs, more people listen to podcasts. And I need to reach the next generation of caregivers because they're already finding out that they're going to be a caregiver pretty soon, or they just found out they're a caregiver, surprise, and they don't know where to turn. And with the internet, there's a lot of noise out there that may not be helpful. I belong to some Facebook groups, and it's the Wild West out there. I see a person posting something and they're asking for help, and all these other people in the Facebook group are giving them help and advice. And I'm sitting there going, well, that's freaking wrong. And I'm thinking, where the hell's the moderator? Because I have a group, and if I see somebody giving advice that I know is wrong, I jump in as a moderator. And if they keep doing it, they're out of the group. Or I'll just shut them down. That's nonsense.
Yeah, no, you got to have guidelines.
Yeah, you have to have God. So where I'm going with this is WordPress. I signed up for this course, and this past July, I took the course and I started producing my podcast. And the program, we meet once a month and we have all sorts of like stuff going on, and we have our own like discussion board, and it's very interactive. So the guy who was running the podcasting group asked me if he could use me as a case study, because he said, you literally showed up for the class and you're like, what's a podcast? And now you've made it past, most people do 10 episodes and they die. He says, you're flying with this, and I'd love to use you as a case study. And I said, sure, because I figured the only people who are going to see this are the 20 people in the class. And he said, well, there is a possibility that WordPress could market it to a larger audience.
Wow.
And I thought, yeah, right, sure. Son of a gun, not only did WordPress feature it in their monthly newsletter that they send out to all the people who have WordPress products, they stuck it in the employee newsletter.
Wow.
So I didn't know all this had happened. I'm at work, doing my stuff, prepping for class, and all of a sudden I'm getting all these like pings, and I look and I'm getting these notifications saying your site is seeing more traffic than usual. Really? Think. And I see I just had like 1,000 visitors, and I thought, oh shit, I'm being hacked. No, it was so this one person tracked me down on my email, and she sent me this real long email where she said, I've been a family caregiver for 4 years, banging my head against the wall, and your email showed up, or the email showed up with your stuff. I've been all over your site. It's like I found the secret garden of dementia wisdom.
Wow, that is.
Whoa.
And this is why I really reached out to you yesterday. Was it yesterday? It was
It was yesterday when we were on the call, like,
so long ago. Um, because I recognize there is there's a lot of pain out there, and it's trending, and I just you are so high vibrational, you are so um you're a light in the darkness, because there's so much despair out there, layered underneath the COVID just came in and plopped on top of that.
yes.
So people who are hanging on by the edge of their nails may not be hanging on so well anymore. And as we try to get past COVID, um, it's we need more bright lights. Um,
And thank you for inviting me to be on this
yeah, of
interview and on your radio show,
course.
because I I really do believe my purpose is to help family caregivers.
Yeah.
And I even had someone email me today, because I sent out an email to all the people who subscribe to my listserv with the 15 strategies or 15 ways to help people with dementia who refuse help. And she wrote back immediately and she says, I love how you take complicated stuff and you make it so simple. And that made me feel good, because that's what I want to do. And I have the blog and I have the podcast, and a lot of people get value from that, and that is awesome.
Well, of
But
course.
there's
Sorry.
also a segment of the population that may need a little more hands-on.
Yeah, I mean, so your target, like I said to you, I'm your avatar. I fit the age group. I fit, a number of the criteria. My parents are not getting younger, and it's time to start preparing for this stuff. But so your target is people like me, my brother, but the
Mm-hmm.
people who benefit are so many more. Like if I had a family, if I had 4 kids, they would be benefiting from your services, because they wouldn't lose their mom to their
Yes.
grandparents. My marriage wouldn't be in so much trouble. My personal finances wouldn't crash and burn. And my parents would be getting much better care. So there are concentric rings that are benefiting very, very in rapid succession, because you're targeting the one who's caring for the one living with dementia.
And thank you for saying that. You said it much better than I expressed it myself. And what families sometimes don't realize is, if I'm the caregiver, if I'm frustrated, if I'm angry, I'm giving off all that negativity, which is transforming the relationship with my family member with dementia into something really negative. We're going to be constantly doing this.
And you're
If I
vibing lower, because that resentment and anger and frustration is,
Yeah.
I mean, vibrate. I'm more of an energetic, vibrational, intuitive health coach type person, and those emotions have a different uh, vibratory signature. And you kind of referred to that before about the emotional. You want to try to keep the emotions high, because once there's frustration or sadness or anger, it pulls in other memories that are connected with that. And what I thought you were going to say when you were talking about that was that people remember how they feel. And so let's say if I'm the caregiver, and the my person I'm caring for gets angry at me for something that I did, would they remember the resentment against me, like in the days to come, even though they have short memory loss? They wouldn't know
probably
why they're mad at me.
probably
Remember they're
probably
mad at me.
probably not.
Uh,
But if you're engaged in the same dynamic day after day after day, you do start, even though people living with dementia may not be able to create a new memory, if there's enough emotional voltage, a memory you'll lay down some track. So,
Imagine, and then it would be like for me, maybe, oh, I got to get up and take care of so and so again.
Yes.
I would be the one connecting those vibrations and experiences with that person. And then it would probably prime me to be in that level of emotion the next day, even though like
Well,
it's
it can also
hard
take
to
a
hit the
toll
reset
on you.
button. Yeah,
It can also take, because you're going to feel depressed.
yeah,
You may decide, I know my mom needs a bath and all these things. I just can't deal with her yelling. I'm not going to do it.
yeah.
You're not attempting to neglect your mom. You just can't handle the behaviors. So as a result, care isn't happening that needs to happen. And
The balance of like maybe self-care for me,
yes,
to not subject myself to the abuse, but the trade-off is, mom doesn't get a bath today, or maybe not even tomorrow either. So
right.
it's such a complex territory to navigate, and I salute you for being the expert scout to tell us where the sinkholes are.
Well, thank you. And
Yeah,
it was a pleasure to be here.
it's amazing. I guess I had one last question, like
Okay.
Columbo. One more question. We're talking about the Mediterranean diet and exercise and what we can do to kind of keep folks living with dementia um, as optimal condition as possible, but also to prevent it for people who don't have any onset at all yet. Um, what I want to go back to when you were talking about in the beginning, where you were taught to orient your clients,
Oh,
and you
yes.
realize that that's the wrong way to do it. And yesterday we talked about the disconnect between when you were working as a nurse assistant and then you were in school, what you were being taught was very disconnected from your practical experience. So my question was this: it seems to me, and I haven't seen these movies, but there have been several movies out over the last maybe 15, 20 years um, based on dementia. And there was a movie a few years ago about a woman who was well past menopause who announced to the family at dinner time that she was pregnant. And
Okay.
her husband was going along with it because she had dementia. But the
Hmm.
children were like, "But no, mom, you're not pregnant. Dad, tell her she's." They were fighting against it, and he just went with her. Every story that she told, he just went with it, and he refused to put her in a home, from what I could understand of the trailer, because he said, "Till death do us part. I'm not going to abandon her, and her story is my story, and we're living this life together." Um, I just mentioned this movie to say that what are your thoughts on when Hollywood takes on this this kind of topic? Um, do you see a trend that this is going to become more of a theme?
It
Even
it may become more of a theme because I it's interesting that I have talked to legislators, to my representatives in Congress about the need for certain resources for family caregivers. And I get the polite nod and then they wander off. Well, it's really very different when that senator or that representative is now dealing with it, him or herself.
Mhm,
All of a sudden, it is now a priority.
mhm,
And I see that pattern in different universities that I've taught. Hey, I think we need to have more content so that nurses, dentists, physicians are able to support people living with dementia and the family caregivers. And time after time after time, I get the polite nod and then I'm escorted to the door until a vice provost is now a family caregiver,
uh-huh.
or somebody in the university who's pretty high up the food chain is now a family caregiver. All of a sudden, my phone's ringing.
They're like, oh.
You need to be doing this stuff. Yeah, it's like, yeah, no kidding, bro. I was in your office 3 years ago and you basically told me don't let the door hit me in my ass. Nice. And now you're living it and you want me to start doing, I'm happy to do it. Don't get me wrong. I'm like,
Whatever it takes.
yeah,
Whatever
but
it
that
takes.
was the trigger. And I wonder about that in Hollywood. You've all these people making movies, I guess, and then when they're living it, all of a sudden, oh my gosh, did you know there was this thing called dementia? Yes. But
And a
that's
culture
human
that
nature.
worships youth, they're focused on making that 23-year-old the next big star, right? So,
But yeah, but that's human nature. If it's not something I'm dealing with, I ignore it because I can only deal with so much. But I do get a little concerned when I see people living with dementia perhaps not being adequately represented, or if it's handled insensitively.
mm,
To be honest, when I watch anything on TV, it's sci-fi. I mean, that's the kind of stuff. Right now I'm watching The Witcher. I think that's like totally cool.
cool.
Dexter, all the nice dark comedies. That's the stuff I gravitate toward. If I see something on, it's like when I was raising my kids, they loved medical shows. They loved House. They loved Grey's Anatomy.
Wow.
I would sit there like the curmudgeon and I would see something happening like on House, one of the physicians taking someone to an MRI. And I'm like, oh, yeah, right. Like that's going to happen,
Yeah,
no. And my kids would look at me and they'd get
that's
really
so not
upset.
realistic.
Yeah, this is such crap. And I would ruin it for them. Well, now it's payback because my kids are now in law enforcement. So I'll be watching, I want to enjoy my Law and Order SVU. And I'm watching it with Sarah, who's a toxicologist. And they're doing this really cool thing. And Sarah's like, that's not a thing, right? There's no machine that does that, right? And I'm like, damn it. And she laughs and says, now you know what it's like because you ruined House for us. Sorry.
Yeah, yeah. Doogie Howser, and what's the other one? The young doctor who's he's high on the autism scale.
Yeah, the good doctor. I don't know. Whenever I see anything that involves medical, I'm like, skip.
Right,
But
right.
that's just me. So to be honest, I haven't really. I watched The Notebook and I saw another show, but I can't think of it. But
Yeah.
I'm not a big consumer of medical shows. But I will have to be, more alert because I am curious sometimes how people living with dementia are presented.
Yeah.
One of the uh, right now, I'm a little frustrated because I do track different Facebook groups because I'm kind of curious what's going on in there.
Yeah.
And there's a Facebook group I've been participating in, and the moderator does a lot of talks about ways to handle behavior, and it's interesting. And I was looking at her videos because apparently she likes to make stuff out of Canva and make that the cover of her video or the screenshot. And I'm looking, and in a lot of the videos, the person living with dementia is being depicted in a very derogatory way, almost being like a caricature. And I have a problem with that. I have had the lived experience of doing a dementia boot camp for about 150 people in the room. And a good portion of the participants were people living with dementia because their caregiver had to bring them. They didn't have an option. And so as I was talking, I was very aware that I had to be careful. I didn't want to insult anybody. I didn't want to upset anybody. So I would start saying things like, well, if I were to have dementia and I were to do, like, I was sort of using myself as an example. And apparently I did it so well that when the talk was over, I had people coming up to ask me questions. and this couple came up to me, and the wife was caring for the husband, and the husband was staring at me, and he looked so concerned, and he took my hand and he said, honey, I was listening to you talk. Do you have Alzheimer's too? And I just said, I haven't been diagnosed. Because that's the truth. I mean,
Oh,
I could have beta amyloid. I mean, there are days, some days when I'm having a rough day, I'm like, maybe I need to make an appointment. I think we all do that to a point, especially
where
as
are
we
those
age.
car keys? Where are those car keys?
Yeah.
Yeah.
Well, it's not where are those car keys. It's I get more worried if you're picking up the car keys saying, what's this?
Oh, yeah. Yeah.
Now you need to come see me.
Haven't done that yet. That I
Yeah,
remember.
good. Okay. So anyway, that's made me very aware and wanting to make sure that when I speak about this topic, it is done, with love and respect.
Well, you're certainly setting the
And some silly
standard.
humor.
Yeah. Yeah. And the humor really helps take the edge off of uh the word that comes to me is take the edge off the tragedy of this, of losing someone, piece by piece, and then learning what their capacity is. And then a few weeks later, the goalposts move and they get
Yeah.
changing, and it's very confusing for the significant other who doesn't have the proper training. And
And that's another thing.
I'm not making any commission. If you sign up with her, I'm not an affiliate or anything.
Okay.
But I do.
But no, but I do appreciate, your
Yeah.
endorsement. And what I try to do is play to the strengths of the person living with dementia. Yes, it is negative. It is a tragedy. It sucks. But I don't want that to be the defining aspect of your journey. I mean, I'm not going to be all sunshine, unicorns, and rainbows like, oh, yeah, this is going to be easy. It's going to be fun. No, it's going to be hard, but I can help it be not as bad. I can help you transform the relationship you have with your care recipient so you're not always arguing and fighting, and it can be a better journey.
And the words are important. Instead of saying dementia patient or suffering from dementia as if they're a victim,
Yes.
saying living with dementia. I like that tweak in the framework, because it's still a whole person
Mm-hmm.
living a different experience.
And I think that's a nurse thing because as nurses, our curriculum, the way we're taught, and I teach nurses, so I'm doing it too, we teach about people first. You take psychology and sociology, you learn about development, you learn about people, and then you learn about the disease. So as nurses, we're very much aware that these are people living with fill in the blank. It's
Yeah.
a nurse thing. I I notice with my physician colleagues, their education, I believe, is a bit different. It's very deficiency based. It's you learn about the disease
Right.
that, and then kind of like the last semester. Oh yeah, by the way, there's a person. I
It
see the
needs to be less
newer,
holistic. It's
yeah, I see the newer physicians doing a better job, but the physicians in my demographic, that was definitely I think that's why a lot of physicians love nurse practitioners and we make a good team because we can balance out.
and not to besmirch any of their training. I mean, but of course, it's almost like their training helps them be more like a human body mechanic, where parts are replaceable,
Mhm.
or you change the oil, or throw some pills at it, and then side effects, so you prescribe other stuff for pills. And I would say
Yeah.
it's like they're practicing the art of medicine, but they're not like doing the science of medicine in a way, because a lot of times they don't really know what's wrong. They're just prescribing stuff from hope that it will help. And I do believe their hearts are in the right place most of the time. But they just don't have that training on the holistic aspects. And, this would be a whole other episode,
I
I'm
was
sure.
going to say this would be a whole other episode, and I can't really speak to that.
Yeah.
I can just speak to what I see in my world of dementia.
Well, I'm so glad you're out there because yeah, the whole person, and not just the whole person, but like we said before, those concentric circles, the whole system, the whole ecosystem of of the loved ones who also are living with dementia. They're living with the issues of dementia. They're living with the person and they're loving the person with dementia. So they are also living with dementia in their own way. So,
Well, again, thank you for having me here. I appreciate the exposure.
of course, whatever I can do. So, in closing, I guess, would you like to repeat your social media, your group, your
Oh, sure.
website, email,
So
whatever you want to share?
all my stuff. So the you can contact me at info@makedementiayourbitch.com. That's one of my emails. You can go to my website, makedementiayourbitch.com. And that's where I have the blogs and the PDF with all the strategies to handle care refusal behavior. I also have a podcast, Make Dementia Your Bitch. And there's a little asterisk where the I is. So it's B asterisk TCH. But I'm on all the major platforms, including Audible. Audible now has podcasts.
Oh, good for you.
Well, I'm a free podcast. Yeah. So I have them. I have it on like 9 platforms. So if you're listening
Goddess,
to
you're like my goddess. I might pick your brain about that in the future. That's very cool. I admire that.
it's actually pretty easy. I use anchor.fm as my platform, and it does a lot of the dissemination for me.
Very cool.
Yeah, if there's a way to automate and hack, I've figured it out because I'm like one button, bing.
Yeah.
So I do like Anchor FM for that reason. They do distribute.
Good to know.
So it's on Spotify, Google Play, all those cool places.
Very cool. So yeah, I did Google yesterday and you came right up, no problem. So
Oh, cool. What did you Google? Make dementia your bitch, and it showed up?
I Googled dementia bitch.
Oh,
Just
really?
just the 2 keywords. It came right
Well,
up.
honestly, on my podcast, I have all the hashtags. I started hashtagging dementia bitch on there because it's like,
Yeah.
why not? Okay, it worked.
Yeah, I mean, of course not referencing you personally, but I was like,
Oh, it's okay.
I'm like, figure make your probably isn't gonna
Yeah,
rank
those are 2
high.
common words.
Right.
Oh, that's funny. Well, I really wanted my original desire for the URL was F-bomb dementia, and that was already taken by somebody in Australia. So maybe it was a good thing because I've caught some slack for that in some of my conservative circles, and I just go, okay.
Maybe they're not in your, they're not your target audience. They will self-select, and I think it's perfect.
Well, here's the thing: if they're a family member of a person living with dementia, that's like my litmus test. If I say, yeah, I have a podcast, Make Dementia Your Bitch, the family caregivers are like, oh, yeah. The people who aren't caregivers kind of make faces at me, and it's like, whatever.
They don't understand, and maybe one day they will, and that's
Well,
not.
that's the unfortunate thing, because oftentimes when I give talks, I'll say how many of you are a family caregiver, and a portion of the room raises their hand, and I'll say, and the rest of you, it's not if, it's when.
That's right.
That's the reality.
Well,
so on that happy positive note,
like I said, you're shining a light in the darkness before people even know the darkness is coming in their family. And so folks, get in touch with her. Check out Make Dementia Your bitch.com. It is spelled out for your URL, right?
Yeah, it is. It is. Because I tried putting the asterisk in it, and the domain people just,
they're like, no. Yeah.
No, can't do it.
So just spell it out, BITC, Make Dementia Your bitch.com. And check out my friend, Dr. Rita Jablonski. And get in touch with her, sign up for her email list. I already did it yesterday.
Oh, thank you. So you can give me critiques and all the stuff I'm doing wrong with
No,
with my.
no, no, you're kidding. I'm like, I sit at the feet of the master. So I'm
Oh
great.
God. Okay. Depends on the day.
Well, thanks again, Rita. It was so great meeting you. I look forward to future conversations, and we will, we will, I hope
We'll
we
keep
do this.
connecting.
Yes, yes. Merry Christmas.
And Merry Christmas to you too.